The monkeypox virus keeps on spreading. In Canada, there are now 604 known cases, while globally, more than 14,000 have been reported in just a few months.
I think that it is much more widespread in our community than just what we're seeing in our confirmed cases.
This virus is circulating in 70 countries across multiple continents, putting pressure on the entire international community to clamp down. While anyone can catch and spread it, the vast majority of global cases remain among men who have sex with men.
And so it does present an opportunity that we can still contain it.
Vaccination clinics are underway for eligible men in some of Canada's largest cities. More than 20,000 doses have been given so far in the two biggest hotspots, Montreal and Toronto. This downtown Toronto physician says infected patients keep coming in, yet demand for shots in that city is starting to slow.
We did see excellent uptake right at the start of the vaccine rollout in May and June, but I think we need to continue to scale it up.
On the West Coast, where case counts are rising, Vancouver officials recently said demand for the vaccine goes beyond their available supply. While on the East Coast, where no infections have been reported,
I was under the impression that it would be a simple call up the travel clinic, hey, can I get a vaccine?
Halifax resident David Gazine assumed he could get a shot through local clinics to protect himself for the future.
It was much more challenging than that.
He had to fly to Montreal to get vaccinated. Now, Gazine questions why only health authorities in some big cities are so far handing out the shots.
I have some big questions. I wonder why we're not being proactive in public health on the East Coast and other parts of Canada that are, in the sense of the greater scheme of Canada, considered rural.
A key question as this virus keeps popping up in new places.
So it is a good question, and we know the vaccination efforts are focused mostly on hotspots, places like Montreal, places like Toronto, but what's next?
Well, there are vaccination sites popping up in a few areas of the country, and we know that federal officials will be in Montreal tomorrow announcing more funding to tackle these outbreaks. But we have been asking questions. Just how many vaccines does Canada have, and where are they going to be going? Federal officials haven't said exactly how many we have in this national stockpile, citing security reasons. Now, obviously, this is an issue bigger than Canada. The World Health Organization is also meeting tomorrow, deciding whether or not to declare a global health emergency.
All right,
Adrienne?
interesting. Security reasons. We'll be watching. Thank you, Lauren.